You might have heard of someone having a temporary stroke. It's the signs and symptoms of a stroke which after a while go away without treatment. The medical name for this has been a transient ischemic attack, or TIA. But a growing number of stroke experts think that the term TIA should be banished because it's actually harmful. One of those experts arguing to abolish transient ischemic attacks from doctors' language is Clay Johnson, who's Professor of Neurology at the University of Texas, Austin.
Thank you. It's a pleasure to be here.
You're talking about retiring the concept of transient ischemic attack. Before we get to what it might be replaced with, just for the record, what are the symptoms of a stroke?
A stroke is a sudden onset of numbness or weakness in one part of the body, or it could be dizziness, it could be trouble understanding or speaking, it could be a decrease in vision in one eye. The key is that it's sudden and it's caused by an interruption of blood flow to a part of the brain.
People have talked for years, many years, decades, about transient ischemic attacks. Now, they've always acknowledged this is a risk factor for a full-blown stroke, but I think you're arguing that we should get rid of it because it is, in fact, a stroke.
Yeah, that's right. The notion before was that, if the symptoms went away, then maybe you didn't need to worry. And then we discovered that, in fact, yes, you do need to worry, that the risk of having a full-blown stroke, even if your stroke symptoms went away, they were very high, particularly in the first few days to weeks after an episode like that. And then as we started to look under the hood a little more, we discovered that almost everyone with these transient symptoms actually had evidence of permanent injury in their brain. And so it just became useless to have a distinct term. If you've had these sudden onset of symptoms that suggest your brain is not working properly, that is an emergency and requires emergent care, regardless of whether those symptoms are mild or not mild, and regardless of whether they seem to go away or not.
And what's the damage that you see?
When you do brain imaging studies, particularly with magnetic resonance imaging, MRI scans, you often see evidence of damage, permanent injury to the brain, the loss of neurons and the other tissue that supports the neurons in the brain.
Do you believe that the perpetuation of the term transient ischemic attack has delayed people getting to hospital for definitive treatment? In other words, people have started to talk about strokes as brain attacks and the same as heart attacks. So you really want to get to hospital ASAP so that you can get your clot dissolved or removed. Do you think the concept of transient ischemic attacks has allowed people to think, well, I'm just going to hang on to see whether it's temporary?
Yes, I think it's been confusing. I think for practitioners, it's also been confusing. Actually, the concept of brain attack is much simpler and reflects much more clearly how both the patient and the physician ought to behave.
So you have a short-lived stroke. Do we know actually how to look after such a person? Because there's a 3-hour window before you get your clot dissolved. How are they supposed to respond in an emergency department?
If a person has basically a mild stroke, they may or may not be a candidate for breaking up a clot or retrieving a clot in a blood vessel, which is the major cause of the strokes that we're talking about. But even if they're not, there are lots of other things that we do that are really important to reducing their risk of having more damage to their brain. And all of those things need to be started right away.
Such as?
For many, we want to block their clotting as best we can. And it ends up that agents that impact the platelet are the ones that are most effective for most people coming in with a stroke, with a minor stroke or TIA, or even with a more severe one. And that's always aspirin. And it may also include one of the newer agents that works with aspirin, like clopidogrel or ticagrelor.
So a double hit there.
Yeah, to pound the platelet to keep that from continuing to clot and propagating a clot, making that whole episode more severe.
Now, if we just continue the metaphor of brain attack, although stroke, for some reason, is not entirely similar to, even though the pathology looks the same, that you get a blockage in the artery, usually in the neck, and a clot spins off into the brain, there are some differences there. But nonetheless, in a heart attack, or if you've got a heart event like angina, it's not just aspirin. You'll go on a blood pressure medication, even if your blood pressure looks normal, and you'll go on cholesterol reduction, even if your cholesterol looks normal. Are those similar interventions that you need after what used to be called a transient ischemic attack?
Yes. You absolutely want to get someone's blood pressure back under control. You may wait a little bit before doing that, but that's a critical intervention. And you want it to be lower than normal, just as you said, and there's data that supports that. And in addition, there are data that support starting a statin even in people with normal cholesterols. But also the clot can come from the heart. So the other thing we have to do is make sure the heart is working well and normally, that there's not atrial fibrillation, for example, an arrhythmia of the heart, because that would lead to a different treatment altogether, and an important one, again, to get started soon.
Because atrial fibrillation, the top of the heart quivers and you can get a clot forming there which then spins off to the brain. Again, just using the heart metaphor or analogy, even if there was minimal damage, cardiologists would go in to open it up, either with a stent or with clot busting, more often than not a stent. Why wouldn't you do that in a transient ischemic attack if you're saying there is brain damage?
Yeah, that's a great question. So if the artery that's abnormal that was the cause of the clot is in the brain, then the data don't support going in, opening it up, putting a stent in there. If it's in the neck, then the data do support either doing surgery or putting a stent in it.
And finally, the narrative that people should have for themselves is that, not that I've had a transient attack, I've had a mild stroke and that needs treatment.
That's all they need to know, that they've had a mild stroke, and then all the things that we've tried to teach them about stroke just fall in line.
So in the same way as you'd respond to chest pain by phoning for an ambulance, respond to the symptoms of a stroke in the same way.
Exactly. The importance of emergency treatment, whether your symptoms have gone away or were relatively mild, or whether they're more severe, the importance of that, it overwhelms you trying to wait to see your primary care doctor because you trust them.
Clay Johnson, thanks for joining us.
Oh, it's absolutely my pleasure. Thanks for covering this important topic.
Professor Clay Johnson is in the Department of Neurology at the University of Texas at Austin.